Welcome to the Vagina Dialogues. I'm really excited today to welcome my guest, Dr. Herb Wong, who is an OB/GYN from Toronto. Hi, Dr. Wong.
Hi, Shirley.
It's
It's
great.
great to be here to talk to you today.
It's great to have you back with us on the Vagina Dialogues. We get so many questions from women who want to see an OB/GYN. They want to know how to have conversations with their gynecologist. And we also have many women who are simply unaware of what their options are when it comes to managing vaginal dryness and vaginal atrophy. So if it's okay with you, can we just dive right in?
Yeah, let's get to it.
Okay. So maybe before I read some of the questions from our community members, speak to us about your work and know that our audience is, primarily Canadian, but a lot of American members as well. So seeing a gynecologist is different when you live in Canada or the US. Is that correct?
Yeah, so when you see a gynecologist in the U.S., so the gynecologists there tend to do a lot more primary care.
Primary care,
So
yes.
so sometimes they'll take care of your thyroid as well, and they'll help you do other things. Sometimes they'll help you monitor your blood pressure. Um, but in Canada, gynecologists are purely a referral service. So usually you'll have your family doctor do your routine pap tests and basic things like prescribe you birth control pills. And then if you need something a little bit extra, then they'll refer you to see a gynecologist. So we see women on a referral only basis, whereas in the States it's a little bit different.
Right. Okay. So that's a great clarification. And then you also have your own clinic, right? Tell us about that.
Yeah, so I'm a full-time staff member at one of the big downtown academic hospitals, and so I do obstetrics still as well. You can see the nice big collage of babies behind me,
Yes.
um, and but half my practice is obviously devoted to gynecology because I am an OB and a GYN. So I see women for a multitude of issues. I do have a subspecialty in minimally invasive surgery, so I do a lot of surgery for various issues. But I'm also very interested in women's health in general. And one of the things that that we're talking about today is vaginal health and vaginal atrophy, which is
Mhm.
a problem that's really growing as more people talk about it. It probably has been there the whole time. It's just that everybody was afraid to talk to it or mention it to their healthcare provider.
Yeah, I think you're right about that. I'm not sure if it's a problem that's growing. I mean, the good news is the conversation is growing. And so more women are talking to each other about it. They're talking to their primary healthcare provider and they're taking action, which is really important too, right?
Yeah, I think it's really important for women to advocate for themselves. I
Right.
mean, they need to speak up because things change very slowly, and the healthcare profession as a giant body changes very slowly. So it's up to women to kind of speak up for themselves. We have this great pamphlet in our waiting room, and basically it says, it's okay to talk about it.
Right.
Okay, and that's the important thing is that you go to see your doctor. If you have a problem or you have a concern, you shouldn't be embarrassed. You shouldn't be hesitant. You should just come out and talk to it.
Absolutely. And one more thing on that point, because it comes up time and time again, is women will say to me, "Oh, my doctor never mentioned anything." And it's like, do not wait for your doctor to mention it because your physician has a lot on his or her mind. There's probably been a lot of conversations firing back and forth in that, 7 to 10 minute appointment. And so if it's an issue or a concern or a question that you have, bring it up with your physician. Would you agree?
Absolutely. And the other thing I would say is don't leave it as the last comment
Yes.
of the visit. So if it's truly the one reason you're there, don't beat around the bush, no pun intended. to bring it up first and foremost and say, the reason I'm here today is I want to talk about, this problem that I'm having with my vagina and my vaginal health. This is why I'm here. Don't hide it behind two or three other things, and then at the very last second say, oh, and by the way,
Mhm.
because at that point in time, unfortunately, people are very busy and it may not get the attention that it deserves. So, bring it up at the very beginning, first and foremost, and then you'll be guaranteed that it'll be addressed.
That's a really good point. And I initially laughed because that's what I did. This this whole
Yeah.
adventure has been born out of what I did. I went for a pap test, sat up, and then launched into, or wanted to launch into, a menopause conversation, which can be like 20 to 30 minutes. So it's really important when you're advocating for your own healthcare to book a separate appointment, be very clear up front and say, this is what I want to talk about. This is my primary concern. And that's the way that we can learn to get the health care that we deserve, right?
Right. And I think, it speaks to human nature. We're all a little bit shy, especially
Yeah.
if we don't know somebody well. And, it's our nature to kind of go slowly, open the conversation and see how they're responding and see whether you're comfortable to talk to them. And then at the very, 15 minutes later, you're like, okay, they seem like a nice person. I'm going to ask the question. Don't do that
Okay.
because, they're busy, you're busy. Just get straight to the point and say, this is my problem. And then they know in their mind, oh, this is why this person is here. This is what the primary problem is. Okay, let's deal with it.
Brilliant advice. Thank you. Okay, we're here today to talk about vaginal dryness and vaginal atrophy, and I have some questions from members of the Menopause Chicks community. So let's get started. The first
Yes.
one is from Laura. Laura is a 53-year-old breast cancer survivor, and she's looking for relief for vaginal dryness.
So for Laura is a special population because Laura's had breast cancer. Laura is probably on medications to help block estrogen and progesterone.
Mhm.
And a lot of times, women who have breast cancer, their tumors are sensitive to estrogen, so
Right.
they're not allowed to have estrogen of any sort. So, in terms of dealing with vaginal dryness, I think that you've talked about some of the options before. There's the options of using lubricants.
Yes.
There's the option of using vaginal moisturizers, and I know that you have an excellent moisturizer from Pure Pharmacy that works really well. And then, up until about 3 years ago, those were the two options that we had that didn't
Mm,
involve hormones. But
okay.
now we're lucky because there is a new therapy that's available in Canada and the U.S., and that has to do with the laser, so
Right.
vaginal laser therapy.
Right.
So just very quickly, laser therapy basically stimulates the tissue to kind of repair itself, much in the same way as the estrogen does. So a lot of times you can achieve the same results with laser therapy as you can by using estrogen, but without the risk of using the estrogen. So essentially, for Laura, the vaginal dryness comes down to moisturizers, lubricants, or something like laser therapy.
So I don't love that Laura had breast cancer. I love that she's a survivor. And I also love that she has this menu of options. And I pray that in the post cancer survival kit, there is a list of those options so that breast cancer survivors aren't left feeling like they've got to figure this out on their own.
Absolutely. And that's like we said before, communication is the key. And she really needs to advocate for herself. She needs to talk to her healthcare providers. If she's not happy with the way things are going in terms of her symptoms, if she's no longer able to enjoy sexual intercourse with her husband or her partner, um, you know, part of being a survivor is enjoying life, right? So to
Right.
get back to normal. So, it's really important to kind of look down all the avenues and to advocate for yourself to kind of see what's available and to take advantage of it.
Right. Quality of life. You nailed it.
Exactly. Quality
Nailed
of
it.
life.
Okay. Our next question is from Julie. And Julie said, I just found out I have vaginal atrophy. My doctor told me to use coconut oil. Then he thought I had a yeast infection. Now he has prescribed Vagifem. It's a bit of a list. I'm
Yes.
52 and this has been going on for years. I can't take it any longer. How do I know what's best for me?
So, uh, a little bit of a complex question about what's best for you, because what's best for one person is not what's best for everybody. Everybody's an individual, and so their treatment and their care should be individualized. So, the coconut oil is something that people have tried. Some of the problems with coconut oil is it's messy. It stains things. It can also change the pH in the vagina and
Right,
lead to more infections.
right.
If you're using latex condoms. Now, I know that this isn't typically the age group that has to worry about getting pregnant. However, there is still the issue of STIs.
Right.
And believe it or not, the population around that age is actually the highest increasing rate of STIs now. So, you still have to be careful. So the coconut oil may not be the best choice. Um, the the yeast infection, of course, clearing up any active infections is important, um, to make sure that your symptoms aren't related to that. So that's that makes sense. As far as the Vagifem is concerned, so that's typically one of the first line treatments for vaginal atrophy, because that's the cause of the atrophy in the first place, is that your ovaries have stopped working, your body's estrogen levels are dropped or have dropped. And so one of the easiest ways is to kind of replace the local estrogen. So the Vagifem is a tablet that's placed in the vagina. It's usually used twice a week. And what that does is it kind of provides the vaginal tissue with some extra estrogen. Part of the problem with Vagifem is that it takes up to 3 months before you start to realize a difference, before you really notice a difference.
Really?
Yeah, well, if you think about it, when you
Yeah.
stop, when you're
Took
going through
longer to lose the
menopause,
estrogen. Yeah.
right, it takes about a year for the tissue to thin out, and you get
Yeah.
um,
Okay.
significant symptoms. So it's going to take a while for that estrogen to kind of bring things back up to speed again. And then the other issue with estrogen is that once you start using it, you have to be consistent. As
Okay.
soon as you stop using it, the effects go away very quickly.
Yeah.
So, um, so what's the best thing for her to do is to keep talking about it and keep saying, to keep going back and say, this worked, this didn't work. This is the symptoms I still have. These are the symptoms that improved. So it's kind of tweaking. You have to go back. You have to kind of report back. Um, and this is what I tell my patients too. It's a little bit of trial and error. So try this. If it doesn't work, let me know. If it works kind of, let me know. You generally don't get it right the first time. You kind of have to mix and match and play with it a little bit, because everybody's different.
Yeah, absolutely. Okay, a couple points to clarify there. Vagifem is a brand name for localized estrogen therapy. So there are other brand names. We're just using that as an example because Julie included it in her question. The other aha moment that you've just given me, Dr. Wong, is we have a number of members who are using or have been prescribed localized estrogen therapy, and they're using the hyaluronic acid moisturizer, probably because perhaps they haven't been using the estrogen therapy for 3 months or for long enough yet to see the benefits that they were hoping for.
Right, exactly. Well,
Got it.
and they kind of work different ways, right?
And
So
everyone's different and at a different age and
exactly.
stage. Yeah. Okay. But thank you for that. I think that really helps and kind of really is important to manage everyone's expectations when they have this menu of options. You also kind of need to know what to expect, because too often we're expecting a magic wand, right?
Right, exactly. That's a very important part or point. A very good point.
Okay. Okay, good. Okay, so let's keep going. Some friends have told me they see a pelvic floor physiotherapist. Others have had laser therapy. What are my options and how do I decide? It's another how do I decide question.
Right. So the two therapies are kind of addressing two different issues.
Okay.
So pelvic floor physiotherapy has more to do with the pelvic musculature.
Mm-hmm.
So for example, if you've had children vaginally, you know that the tissue there gets stretched out. So sometimes there's laxity, which means that the tissue is a little bit looser than it was before. The muscles are a little bit weaker. So pelvic floor physiotherapy is kind of focusing on the muscles. So it's like when you go to a physiotherapist for, your shoulder or your elbow or your knee, they're going to give you some exercises to do so that you kind of regain the muscle strength and the muscle tone. So a pelvic floor physiotherapist, they're going to help you kind of get back the tone of the pelvic floor muscles by doing exercises. They can also help you diagnose certain issues with the pelvic floor causing pelvic pain.
Mm-hmm.
So that's a little bit different than the laser.
Right.
So the laser is the laser is for vaginal atrophy. So when we talk about atrophy or thinning, we're talking about specifically the thinning of the lining of the vagina.
Okay.
So the lining is not the muscle layer. It's kind of the layer that you touch. So, and that's the layer that thins out. That's the layer that provides moisture. That's the layer that provides sensation.
Mm.
So the pelvic floor physiotherapist and the laser, they're different things for different problems.
Okay.
So when you ask what are my options and how do I decide, so you have to kind of tease out what exactly are the symptoms. Is it that you're having issues with your pelvic floor in terms of discomfort, in terms of laxity, in terms of bladder control issues, or is it more vaginal dryness, pain with intercourse, itching, burning, things like that? So the two are close, but they're not quite exactly the same thing.
Okay. Good. Thank you for clarifying that. So it might be one, might be the other, might be both.
Right, might be both, exactly.
Got it. Okay. All right. Janice wants to know if she's taking hormone therapy, and I think she means orally. If I'm taking hormone therapy, can I also get a prescription for localized estrogen therapy?
So that's a great question. So Janice, most doctors will prescribe oral hormone replacement therapy because they're trying to address all the different symptoms that you may have. So that would include the hot flashes
Mhm.
and the mood swings and the difficulty sleeping. So a lot of times we want to be very conservative. We only want to give as much hormone to kind of get rid of the major symptoms like the hot flashes. That might not be enough to kind of stimulate or replace the tissue in the vagina. So
Right.
you might need a little bit more estrogen locally in the vagina. So uh, the answer is yes, you can also use local estrogen therapy as well as the oral systemic therapy.
Good news. Thank you.
Yes.
Okay, Kelly. Oh, I love this question because it's a prevention question. Kelly's 49. She'd like to prevent vaginal dryness. It sounds awful. What do you recommend?
So, um, we talk a lot about, vaginal dryness and some of the causes, be it irritation, be it infection. I think for this conversation, we're really talking about vaginal dryness related to menopause and the lowering of estrogen levels. So, unfortunately, until science and medicine figures out how to prolong menopause, um, it's not something that you can really prevent, but more importantly, it's something that you should be vigilant of. So, meaning that when you start to notice symptoms early, it's much easier to treat than if you were to let it go for 2 years and then finally decide, you know what, now I'm going to do something about it. So I think just being aware that it may happen as soon as you stop having periods and to be on the lookout for it, I think that's probably a better approach so that you can deal with it earlier, and that way you can get much better results.
I love that answer because so often, maybe it's human nature and we're conditioned to do so, or maybe it's part of the menopause conversation that needs to change. But so often, women are coming from a mindset of, oh, I just have to suck it up. I just have to get through this. When in reality, this is one of the experiences that won't get better with time.
Exactly. And you know what? I think it's horrible that, you know, we still live in a mostly paternalistic society where, you know, women are expected to kind of put their health at the end, you know, because they want to take care of their families, they want to take care of their parents, they want to take care of their careers, and only when they take care of everything else can they look back and say, okay, now let me help myself. And you know, my answer to that is, you know, you can help others when you're your best. So you need to take care of yourself first so that you can be your best to take care of everyone else. So you really need to kind of, you know, look inward and say, how do I make myself better first? And then I can be the best me for everybody else.
Okay, I wasn't expecting this, but you're going to make me cry. That's the beautiful message that every woman needs to hear. Thank you, Dr. Wong.
You're
Um,
very welcome.
yeah, so one of the things that I like to emphasize and say on repeat is, you know, you have options, and one of them is not suffering in silence. So we're so grateful that you've lent your time and expertise to us today for the Vagina Dialogues. Remind everyone how they can learn more about your work and how they can get a hold of you.
Absolutely. So if you want to follow us on Instagram, we're at Mona Lisa Touch Toronto. If you
Okay.
want to see us on Facebook, it's Dr. Herb Wong. And if you want to go to our website to learn more about the vaginal laser and how it can help you, it's Mona Lisa for me, the number 4.ca.
And
And I'm sure you'll have listings.
I will share those below.
Yes.
Thank you so much for joining us. I hope you'll come back.
Oh, absolutely. It's been a wonderful talk with you today.
Okay, take care. Talk to you soon.
You too.